Hello, my name is Samantha Rushak. Today I'm going to be performing a head, eyes, ears, nose, and throat assessment. Before we start, can you verify your name and date of birth for me?
Skylar Rushak, birth date 12/30/03.
Okay, before we start, I'm just going to put some hand sanitizer and clean my hands. And today I'm going to start out with your skin. So what I'm going to first do is just visualize your skin. I'm looking for any rashes, bruises, dry spots, any papules, or anything that looks abnormal. I'm next going to take the back of my hand and I'm just going to feel your skin for temperature and moisture. Go ahead and straighten out your leg for me so I can feel that other one. Perfect. Next, I'm going to be looking at your nails. Here I'm just looking for the shape and consistency on both hands. I'm looking at your cuticles, their angle, looking at your fingertips for any cyanosis or clubbing, which I don't see on either. Next, I'm going to check your capillary refill, one finger on each hand. And they are less than 2 to 3 seconds. Additionally, I want to check them on your toes. Is it okay to remove your socks?
Sure.
Perfect. Just set your sock here. Good. And they're less than 2 to 3 seconds. It feels warm and appropriate. Your skin is malodorous and you look like you have good hygiene. Moving on from the skin, I'm going to start with your head. Here I'm just looking for shape and symmetry. I don't see any ptosis or involuntary drooping. Your eyebrows and eyelashes and eyes, they're symmetrical. The hair's evenly distributed. I'm going to look at your scalp. I'm looking for any lice, mites, any bumps, bruising, bleeding, anything like that. Okay, I don't see any. I'm going to go ahead and feel the shape of your skull. I'm going to start in the front and work my way to the back. And the shape feels normal. I'm then going to palpate the rest of your head for any lumps or bumps. Okay. Your hair looks to be a nice brownish blonde color, good consistency, good texture. I don't see any missing patches or balding spots in the back or anything like that. I'm next going to take my stethoscope and I'm going to listen for any bruise. I'm going to listen above your eyebrow, on your temporals, right down here by your thyroid, and then your carotid. Before I do this, I do want to feel your temporal pulses. Okay, I'm going to go ahead and listen. I'm going to place this right above your eye, so if you do want to close your eye for the first one. You can go ahead and open. Perfect, thank you. Next, I'm going to move on to your neck. So here I just want to take a look at symmetry. It looks nice and full. I want to go ahead and check the positioning of your trachea to make sure there's no deviation. I want to check your hyoid. Go ahead and swallow. Perfect, it raises up just appropriately there. I'm going to spin you around here. I'm going to step behind you and I want to palpate your thyroid gland. Here I'm feeling for shape, size, and consistency. It does not feel abnormal. It's an appropriate shape and size. It's consistent throughout. Next, I'm going to go ahead and palpate your lymph nodes. I'm sorry, I'm just going to turn you a little towards me here. I'm going to start with your pre and post auricles and work my way down. Any recent sickness or any reason I could expect maybe your lymph nodes to feel a little bit enlarged here? Have you ever went to rub your neck or anything like that and you noticed a bump or anything feeling abnormally large?
No.
Okay. Perfect, thank you. Next, I'm going to feel your temporomandibular joint. Here I'm checking for any crevitus. Once I place my hands on your face, go ahead and open your mouth once or twice. Any pain? Perfect, and I don't feel any crevitus, so that's good. Moving on to your eyes, I'm going to take my little tool here just to measure your pupils. Okay. I'm going to shine a bright light. Just go ahead and keep looking at me. Alright, so your pupils look to be 3, they're round, they are reactive. I'm looking at your irises here, you have nice brown eyes. I'm going to pull down to look at your conjunctiva. New capillary here, perfect. I don't see any abnormal drainage or anything like that. No crusting or lesions. I'm gonna set this down. And like I said, your lacrimal glands look appropriate. They don't look like they're draining heavily or anything like that. Next, I'm going to take my otoscope. I want to look at your eyes. Here I'm looking for the vessels. I want to look at the disc and the macules. I am going to have to get relatively close to you, so I just want to make you aware before I do so, okay? I'm going to start by using my right eye and coming in to look at your right eye. Okay, and next I'm going to use my left eye to examine your left eye. Now I have my Snellen chart. I'm going to place this in front of you, and to your best ability, I want you to read the last line.
LTFPH.
Any trouble?
No.
What about when you're driving at night? Is it ever harder to see? And do you wear any glasses or contacts?
No.
Okay. I'm next going to check confrontation, and I'm going to do this by placing my fingers behind you. When you see them come into your vision field, let me know.
No. No. No.
Perfect. Next, I want to track your extraocular muscles. I'm going to do this by performing the 6 cardinal field of gaze. So what I'm going to do is stand in front of you, keep your head still, and just with your eyes, follow my finger. Go ahead and follow my finger in. Perfect. Next, I'm going to go and look at your ears. I'm just going to start by palpating the lobule and the pinnas. Here I'm feeling for any masses. Do you have any pain when I'm doing this? Okay. Next, I'm going to look in your ears. I'm just going to start like this. Here I'm looking at your tympanic membrane and your canal. I'm looking for any foreign bodies, any drainage, redness, or bulging. Just going to come around to the other side. Perfect. I don't see anything abnormal. I do see some earwax, which that is normal. But next I want to test your hearing to make sure you don't have any hearing loss. So we're going to start by doing the whisper test. I'm going to have you cover one ear. I'm going to whisper something to you. Tell me what you hear. Christmas.
Christmas.
And for the other side, go ahead and cover. Halloween.
Halloween.
Perfect. Next, I'm going to perform the Weber's test. I'm going to strike this on the top of your head, and I want you to tell me if you hear it in one ear, both ears, or none at all.
Both.
Both? Perfect. Next, I'm going to do the Ryan's test. I'm going to place this on your mastoid process, and I want you to tell me when you no longer hear it.
Now.
Can you hear this?
Yes.
Perfect. And again on the other side.
Now.
Can you hear this?
Yes.
Perfect. Skylar, next I'm going to move on to your nose. Here I'm just inspecting it for shape, size, and symmetry. I'm going to go ahead and palpate. Let me know if you have any pain. I'm going to have you cover one nostril. Go ahead and breathe in and breathe out. And again on the other side. Wonderful. Next, I'm going to look in the membrane. I want to make sure it's pink and moist. I want to make sure there's no deviated septum, and I just want to make sure everything looks appropriate, okay? Okay, and for the other side? I'm sorry, I am coming pretty close and personal to you. Perfect. I don't see any foreign bodies or anything like that. Lastly, for the nose, I just want to feel your frontal and maxillary sinuses. Have you had any additional drainage, especially within the summer months, of allergies, congestion, or anything like that? Okay. Lastly, we're going to do your mouth. I want to go ahead and put my gloves on. I'm just going to go ahead and open my tongue depressor. And I'm just gonna start by inspecting your lips. Here I'm looking for symmetry, the color, making sure they're pink and moist, there's no cracking. Go ahead and stick out your tongue for me. Also pink and moist, no cracking. Give me a smile with teeth, yep. Inspecting for any lost teeth. Go ahead and open your mouth, which I don't see any. That's perfect. I'm gonna take my light here. I'm just gonna look at your gums. I'm gonna have you open your mouth and say, ah. Here I'm gonna be looking at your soft palate, hard palate, uvula, and tonsils. I'm gonna elect a gag reflex. Perfect. Next, I'm just gonna kind of feel around your mouth. Any pain or any dental activities recently?
Mm-mm.
Have you had your wisdom teeth out?
Mm-mm.
But they don't bother you, you don't have pain with them?
No, not at all.
Okay, perfect. So it looks like you have great hygiene, your teeth are appropriate, your breath is malodorous, it looks like everything is intact and no complaints. So I want to thank you for participating in this assessment today. Like I said, this was the head, eyes, ears, nose, and throat with Skylar Rushak. Thank you so much, Skylar.
Thank you.